responsiveness because Dr. Rajesh is going to have a class on that. But basic premise, preload is not fluid responsiveness. Fluid responsiveness is the ability to know that if you give a volume, is that going to increase your stroke volume and thereby increase your cardiac output? That is fluid responsiveness. If I measure preload in all of us are fine, we are healthy, we will be fluid responsive. All of us will be fluid. That is the normal state. But does that mean that we need fluid? No, we don't need fluid. Okay, so we need to understand that differentiation. Okay, now why do we want to know why do you think we want to know pulse contour based analysis may be more useful in a situation, in an ICU kind of situation? Because we know from evidence that static variables that we were using, like central venous pressure or pulmonary capillary wedge pressure, etc., is no more used for fluid management because it has been found that they do not correlate with the ability of a patient to increase cardiac output or stroke volume by giving a fluid challenge. It has been known that now we know by evidence that dynamic parameters are what is far more relevant in assessing fluid responsiveness than static parameters. Now, what do you mean by a dynamic parameter? A dynamic parameter is nothing but a parameter that changes with a hemodynamic challenge. Now, what is the classic hemodynamic challenge that you give? You give volume. When you give volume, you're trying to increase the preload, and you're thinking this increase in preload, is it going to change the cardiac output? Now, without giving fluid, how can you measure this? By variation of respiration. Because of the respiratory changes that happens in the intrathoracic pressure changes that happens, there is a change in the stroke volume during inspiration and expiration. In my earlier talk, I told you that there is a inspiratory decrease in blood pressure with spontaneous breath. Now, the opposite happens in a patient in mechanical ventilation. Okay, what happens? During inspiration, the right ventricular preload decreases and the right ventricular afterload increases. I'm not going to go into the details of this because Dr. Rajesh will be talking about it in a subsequent talk. But in a nutshell, during inspiration, there is a decrease in right ventricular preload and there is an increase in right ventricular afterload. So what happens to the right ventricular output in inspiration? There is a decrease in right ventricular stroke volume during inspiration. Mind you, I am talking about inspiration, mechanically ventilated patient, not spontaneous respiration. Okay, what happens during in the left side of the heart? There is an increase in left ventricular preload. At the same time, there is a decrease in the left ventricular afterload. So what happens? There is an increase in left ventricular stroke volume. So during inspiration, there is a decrease in right ventricular stroke volume, but at the same time,